Welcome to Midnight Nurse, Psychiatric Nursing Part 4, Question and Answers. The question is, prognosis in schizophrenia is less favorable if emotional blunting. Answer is C. If emotional blunting occurs, prognosis in schizophrenia is less favorable. Answer is C. Answer is C. Next question. First rank symptoms of schizophrenia are all except here ambivalence. Ambivalence is not a symptom of schizophrenia. Running commentary, somatic passivity, primary delusion. These three things are symptoms of schizophrenia. First rank symptoms of schizophrenia. Here the answer is ambivalence. Next question. First rank symptoms of schizophrenia are all except. Here 4 options are given. 3 options are correct. Then one option is not correct for schizophrenia symptom. This is the depersonalization. Depersonalization is not a first rank symptom of schizophrenia. Depersonalization is not a first rank symptom of schizophrenia. Then next question. Poor prognostic factor in schizophrenia is great answer gradual onset. Gradual onset. Which of the following is the treatment of choice for a patient with schizophrenia who refuse to take treatment? Who refuse to take treatment? That is, the answer is risperidone. Risperidone is the treatment of patient with schizophrenia who refuse to take treatment. The next one, schizophrenia drugs mainly act on. Schizophrenia drugs mainly act on. Answer is second B. Answer is B. Dopamine D2 dopamine receptors. D2 dopamine receptors is the answer. Then next question. Meaning of term schizophrenia is split mind. Split mind. Mind will split. Split mind is the schizophrenia meaning. Answer is C. Cause of premature death in schizophrenia is, answer is suicide. Suicide is the answer. Cause of premature deaths in schizophrenia is suicide. Answer is C. Answer is C. Then next one, schizophrenia is characterized by all except elation. This is not characterized by schizophrenia. This is not characterized by schizophrenia. Next question. Characteristic clinical manifestation of schizophrenia is. Characteristic clinical manifestation of schizophrenia is, answer is auditory hallucinations. Auditory hallucinations. The next one, most common hallucination in schizophrenia is auditory. Auditory hallucination. Answer is A. Then next one. Next question. All of the following factors are associated with poor prognosis in schizophrenia except poor prognosis in schizophrenia. Predominantly negative symptoms. This is not associated with poor prognosis in schizophrenia. Answer is C. Rapid onset of symptoms, family history of schizophrenia, onset of illness in early age. These three things are associated with poor prognosis in schizophrenia. Then next question, most common type of schizophrenia is paranoid schizophrenia. Then next one, waxy flexibility. Characteristic of schizophrenia is waxy flexibility. Characteristics of schizophrenia is stuporous catatonia. Stuporous catatonia is the flexibility, waxy flexibility characteristic of schizophrenia. The following are cluster A personality disorder except this is paranoid, schizoid, schizotypal. These three things are cluster A personality disorders. Histrionic is not a cluster A personality disorder. Answer is D. Next one, most effective treatment in borderline personality disorder. Most effective treatment in borderline personality disorder is behavior therapy. Behavior therapy. Most effective treatment for personality disorder. Behavior therapy. Answer is B. Then next question, in schizoid personality disorder, all are seen except in schizoid personality disorder, all are seen except suspicious. This is not seen in personality disorder. Answer is C. Then next question, lifelong theatricality of behavior is seen in hysterical personality disorder. Hysterical. Which of the following is a cluster C personality disorder? Which of the following is a cluster C personality disorder? Avoidant personality disorder is a disorder. Answer is A. Then next question. Antisocial personality disorder is characterized by unconcern. Answer is C. Unconcern for feeling of others. Regard for social norms. Social norms. Next question. All are cluster B disorder of personality. Antisocial and narcissistic, borderline. These three things are cluster B disorder of personality. Then avoidant is not a cluster B personality disorder. Answer is avoidant. Avoidant is not a cluster B disorder of personality. This is the answer. C is the answer. Next question, characteristic feature of schizoid personality. Characteristic feature of schizoid personality is emotional coldness. Emotional coldness. Answer is D. Then next one, antisocial personality is seen in with drug abuse. Answer is A. Drug abuse. Antisocial personality is seen in drug abuse person. Next question. Features of anxiety neurosis are the following except. Features of anxiety neurosis are the following except. Here excessive sweating, palpation, tremors. These three things are features of anxiety neurosis. Here the loss of consciousness is not a anxiety neurosis. Feature of Not a feature of anxiety neurosis. Answer is C. The next one, thyrotoxicosis is most commonly associated with thyrotoxicosis is most commonly associated with anxiety. Answer is anxiety. The next one, anxiety is neurosis. Anxiety is neurosis. Anxiety is a neurosis disorder. Then next one, differentiation of hysterical fits from epileptic fit is occurs when people are watching. Occurs when people are watching. Then next one, answer is D. Then next one, uncertainty and excessive sense of responsibility is seen in. Next question. Next one, uncertainty and excessive sense of responsibility is seen in generalized anxiety disorder. Generalized anxiety disorder. Answer is D. Diagnostic interview with sodium amytal or hypnosis is a special feature of post-traumatic neurosis. Post-traumatic neurosis. Answer is A. Then next question, kleptomania means irresistible irresistible desire to steal things. Irresistible desire to steal things. Answer is B. Then next one, common type of phobia seen in clinical practice. Agoro agoraphobia. Common type of phobia seen in clinical practice. Clinical practice. Answer is C. Agoraphobia. Then next question, mental illness that causes bodily symptoms including pain and the symptoms cannot be traced back to any physical cause is known as mental illness that causes bodily symptoms including pain and the symptoms cannot be traced back to any physical cause is known as somatoform disorder. That is somatoform disorder. Answer is C. Answer is C. Answer is C. Next question. An idea thoughts that continually preoccupies or intrudes on a person's mind is known as obsession. Answer is B. Obsession. Then next question. Drug most useful in treatment of obsessive compulsive disorder. The drug most useful in treatment of obsessive compulsive disorder. OCD. Answer is fluoxetine. Next one, treatment of choice for OCD is combination of behavior. Answer is D. Combination of behavior and drug therapy. Combination of behavior and drug therapy. The next question, all drugs are used for treatment of OCD except diazepam. Except diazepam will not use in treatment of OCD, obsessive compulsive disorder. Carba, carbamazepine, lithium, fluoxetine. These three drugs are used in obsessive compulsive disorder. Next question, administration of neuromuscular blocking agent before ECT can cause respiratory difficulties. Then next question, following ECT, a client is receiving oxygen via positive pressure ventilation method. The nurse should understand that positive pressure ventilation is necessary because The answer is succinylcholine administered during procedure can cause respiratory depression. Respiratory depression. Answer is D. Then next question. Prior to ECT therapy, client is given with atropine to minimize secretion. Here the answer is B. Minimize the secretions. Next one, the most common side effect of ECT is temporary memory loss. Answer is temporary memory loss. Then next question, among the following, what is the important nursing intervention to maintain safety of a client who is receiving ECT? Among the following, what is the important nursing intervention to maintain safety of a client who is receiving ECT? We have to maintain elimination of benzodiazepine for nighttime sedation. Elimination of benzodiazepine for nighttime sedation. Next one, the sequence of administration of medication in anesthesia for ECT. While giving anesthesia, sequence of administration of medication. The answer is atropine, thiopental or methotrexate and succinylcholine. This medication should be, we have to give sequence orderly we have to give. First we have to give atropine, then next thiopental or methotrexate or then succinylcholine. Answer is A. Next one, the drugs need to be administered to a client immediately before ECT include. The drugs need to be administered to a client immediately before ECT include. Immediately before ECT include. All of the above. Answer is all of the above. Thiopental, sodium, succinylcholine, then methotrexate, sodium. These three drugs are before giving ECT, we have to give these drugs. Then next question. When explaining the procedure about ECT, nurse should emphasize that when explaining the procedure about ECT, while explaining the ECT, the nurse should emphasize that client will not be alone during the treatment. Client will not be alone during the treatment. Answer is D. Then next one, nurse attending to a patient receiving electroconvulsive therapy in a psychiatry department should ensure the complaints of all of the following except the again the question is, the nurse attending to a patient receiving electroconvulsive therapy in a psychiatric department should ensure the complaints of all of the following except. Answer is empty of bladder and bowel is not necessary. Which one is necessary means, here the patient hair should be kept clean and dry. Then hairpins, bracelet, body piercing should be removed. Then take the informed consent from patient legal hire. These three things are necessary for the before giving electroconvulsive therapy. Next question. ECT is not the first line treatment for ECT is not a first line treatment for mania. ECT is not the first line treatment for mania. The ECT is first line treatment for severe psychotic depression, catatonia, depressive stupor. Here the answer is mania. ECT is not the first line treatment for mania. Question. Most common complication of ECT is retrograde amnesia. Retrograde amnesia. Loss of memory. Retrograde amnesia. In direct ECT, the intraocular tension is decreased. The intraocular tension is decreased. Answer is B. Then next question. One, the voltage needed to produce seizures while giving ECT is the voltage given to produce seizures while giving ECT is answer is D. 70 to 130 volts. Answer is D. 70 to 130 volts. Then next one, nursing care in electroconvulsive therapy include all of the above. Answer is D. Preparing and monitoring the patient during actual procedure. Then next one, providing educational and emotional support. Then next one, pre-treatment planning and assessment. This next question. As per the Mental Health Act 2017, which of the following statement is not true regarding ECT therapy? Answer is D. Direct ECT can be given with consent of the patient. Direct ECT can be given with the consent of the patient. Answer is D. Then next one, immediate nursing intervention for the patient who has just awakened from the electroconvulsive therapy treatment is to orient the patient. Answer is orient the patient. Next question, which of the following is an absolute contraindication for ECT treatment? Answer is pheromocytoma. Then answer is D. Next one, ECT procedure was first used for treatment of psychosis in the year is 1938. Then next one, the normal range of duration of electricity delivery during ECT is 0.7 to 1.5 seconds. 0.7 to 1.5 seconds. Then next question, the most common indication of ECT is major depression. Then next one, which of the following type of schizophrenia best respond to ECT? Catatonic schizophrenia. Then next one, the most common side effect of ECT is dislocation of mandible. Answer is A. Next one, electroconvulsive therapy is primarily used to treat patient with depression. Electroconvulsive therapy is primarily used to treat patient with depression patient. Then next one, a mental disturbance characterized by confusion, disordered speech, clouding of consciousness, and hallucination is known as delirium. Answer is delirium. B. Answer is delirium.